Most people don't know the number one danger of fatty liver disease isn't liver failure. It is actually heart attack. I'm talking about early heart attacks, brain strokes, and diabetes. Most people with fatty liver don't end up with cirrhosis because there is something else that has cut short their life, whether it is their heart, brain, or pancreas. Let me explain to you why fatty liver is one of the most underestimated killers. Fatty liver disease, which is most often we nowadays see, is non-alcohol related, where there is excess of buildup of fat in the liver without you actually drinking any alcohol or very little alcohol. It is now the leading cause of liver disease throughout the world. If we take cities like Bangalore, where I am practicing, 1 in 3 people have fatty liver disease. So this deposition of excess of fat in the liver happens silently and can slowly start causing irritation, inflammation in the liver, what we call as steatohepatitis. And then this eventually leads to scarring. And the scarring, as it gets worsened, it will permanently damage the liver, what we call as cirrhosis. So this permanently damaged liver can go on into liver failure. But the catch is most people with fatty liver disease don't die from liver disease. They die of something else much early. Here is the most shocking part that even a lot of doctors miss out. People with fatty liver disease are 2 to 3 times more likely to end up with having a heart attack, stroke, diabetes, blood pressure, all of this what we call as metabolic syndrome. So fatty liver is not just about your liver. It is a warning that your entire system, entire metabolic system is failing. So think of fatty liver as the first alarm bell before other conditions slowly start to kick in, like BP, sugar, cholesterol. You might feel that you're healthy, but you might be at risk. You don't need to be very obese to actually get fatty liver. Sometimes, unfortunately, in my clinical practice, I see people with normal weight can still get fatty liver disease. So they are thin outside, but inside there is more fat. If you're carrying, of course, big belly fat, if you're eating a high carbohydrate rich diet, which a lot of our Indians do, a diet that has also got high amount of sugar, if you have a condition where there is slowly development of this insulin resistance, so pre-diabetes, already without you knowing about it, if you have high levels of bad cholesterol, these triglycerides, or low levels of the good cholesterol we need called HDL, or if you're leading a lazy, sedentary lifestyle, even though you might be feeling healthy, but your liver is starting to store the fat quietly and starts to trigger inflammation, irritation, which just happens in your entire body, not just the liver. How does fatty liver become a risk factor for heart disease and stroke? So fatty liver is not just about the fat in the liver. It releases certain inflammatory chemicals into your bloodstream. So this puts you at a risk of this condition called insulin resistance, which further goes on to develop diabetes. It can start affecting your cholesterol levels, where there are high levels of the triglycerides. And eventually all of this will start building up this plaque in the arteries that supply blood to the heart, what we call as this atherosclerosis process. So there is more and more buildup of the plaque, which means now your liver disease is slowly turning into heart disease. If you fix your liver, you will definitely protect your heart, your brain, and also your pancreas. In my next video, I will explain 5 simple steps to fix fatty liver. And yes, you heard it right. You can fully reverse fatty liver. Please do not forget to subscribe to this educational channel to look out for more digestive health videos that are science and fact-based. Thank you.